Patients who come to see our team here at Great Ormond Street, often they've got very limited options for treatment. But we've now got gene therapies that are safe, that are effective, and actually they're curative, which is fantastic because these amazing therapies, which were just dreams 30 years ago, are now reality.
My name is Remi. I'm 20 years old. I live with my mum and dad and my sister. I was always the shortest and the youngest. Now I'm the youngest, but second tallest. So when my mum usually needed something from the high shelf, she would call my dad, but now she calls me. I got diagnosed at 2 years old with a very rare, extreme genetic condition named CGD, chronic granulomatous disease.
Remi is amazing.
Sorry.
That was me. He's so bubbly and so fun, and it's just so much energy, and it just sort of gives off that energy to other people as well. I feel like he doesn't recognise the hardship he's faced as much as he has, but I think the people around him who knows what he's been through, they do.
CGD weakens the immune system. I've been in and out of hospitals for most of my life. Doctors said I can't do anything, I can't play in the woods, I can't play in the sand. Essentially, the best thing is not to do anything. I felt very different to other children my age. I had to take time off school. It affected my social life incredibly. I actually had no friends. I feel like I was missing out a lot.
Immune deficiency disorders like Remi's, it's a faulty gene in the bone marrow. Patients who have CGD, they're really at risk of developing very severe bacterial and fungal infections. Patients can die of the infections that they get.
Most of my childhood, I managed my condition with antibiotics up until the age of 16, where it kind of deteriorated. I developed fungal infections in lungs, inflammatory bowel disease, and then a bone infection. I got admitted to Great Ormond Street Hospital.
Historically, the treatment for the immune system disorders like Remi's was a bone marrow transplant. But the outcomes from bone marrow transplant often weren't very good. And so here at Great Ormond Street, we're exploring gene therapy. Gene therapy is modifying a person's genes to treat or cure a disease. In Remi's case, giving a patient a new immune system. The gene therapy field began in immune deficiency disorders about 30 years or so ago, actually, here at Great Ormond Street and other centres. That technology has enabled new treatments for cancers and has allowed gene therapy to expand into many, many other different disease areas. A lot of the Wellcome Trust funding that we've benefited from has been what we call preclinical studies. The bench work of finding the problem, developing a gene therapy for it, and then taking it up to the point that it looks safe enough and efficient enough to move into a clinical trial. So the trial that Remi was part of, it's a new trial that opened a couple of years ago. It was using techniques that we've used before, but it was the first time that this had been applied to the disease that Remi has. So we asked Remi to basically be the first patient in the world to receive this new treatment. And so we have to acknowledge that the families are putting a huge amount of trust into us.
My parents and sister were nervous for me. They were just sat there looking at me getting injections, and I just sat there on my phone, just in my own little bubble. I thought at least there was some kind of hope. After my treatment, straight away when I got home, I definitely felt better. There's no gut symptoms. I gained an insane amount of kilos. I feel like a normal person. It changed my life. I managed to do my A-levels, got into university. My parents are very proud of me. I've got friends now, really good friends, really close friends. I managed to get myself a girlfriend, my lovely girlfriend Nadine.
Hey, how are you?
Yeah, not too bad, thank you.
But you look really well.
Yeah, I feel much better to do this.
Yeah, definitely, like your face, your skin, everything, just, you really look well. Remi had his gene therapy 18 months ago. He's off pretty much all of the medications that he was on beforehand. I think we would be confident to say that it's worked in his case. And that's amazing.
All right, I'll see you.
We'll see you next month. Take care.
Take care, thank you.
All right then, bye. Bye-bye.
The Wellcome Trust's contribution to gene therapy has been enormous. Investing in scientists to make sure that we can continue to develop new cures. These amazing therapies, which were just dreams 30 years ago, are now reality for quite a lot of patients.
Going through what I've been through, it definitely taught me never give up and always have positive hope.
We're still recruiting patients for the trial that Remi was treated on. Our hope is that that would become a treatment that was available for all patients with this condition around the world.